New recommendations are out when it comes to testing your cholesterol, and the age is a lot younger than you might think. Joining us now to explain this all, Dr. Elizabeth Epstein with Scripps Clinic. Doctor, good morning, and thank you for your time today. Okay, cholesterol. I know a lot of people, I was just telling you in commercial break, I just got mine all tested, and when the doctors read out the numbers, I'm like, what does that mean? What does that mean? So what do all these numbers mean to have a high cholesterol or normal cholesterol?
Yeah, so cholesterol is important. It's one piece of a larger puzzle of what contributes to cardiovascular risk. So what leads to plaque in the heart arteries, which can lead to heart attacks and strokes down the road. So it's an important thing to have tested and to know your risk. And these guidelines are focusing on advancing our field and in how we assess risk.
And these are new recommendations that are out right now?
Yes.
What are they?
They are the new guidelines for managing cholesterol from the American Heart Association, American College of Cardiology.
Okay.
And after reviewing almost a decade of research that we have in the field of prevention, we've updated our recommendations for how we screen and how we manage cholesterol.
Okay, what is the recommendation? Are they lowering the age now, or what was it typically, and what is it changing to?
So the most important piece is that we've changed to a new risk calculator called the Prevent Calculator, that we're actually looking at treating people 10 years sooner than we used to. So it used to start at age 40. Now we're looking at testing, treating people at age 30 to start to try to prevent disease earlier in life. So we're shifting to upstream risk and looking at preventing disease even 30 years down the line.
So when you go back 10 years and you started there, is, from what I'm hearing from you, it's to prevent this, because by the time you get there, it's so much harder to fix it than if you can get ahead of it.
Absolutely. It's a silent disease process that can lead to a lot of suffering many years down the line, and it's almost completely preventable. So we can actually look for signs of trouble many, many years earlier and start to treat and prevent unnecessary deaths later in life.
Doctor, when you say that this is preventable, our 20-year-olds watching right now, what should they be doing at this age, or maybe even younger? Does it start in childhood?
Yeah, these guidelines also had a new push to test children even around age 10.
Wow.
And that's really to rule out the familial high cholesterol, so very, very high cholesterol that we can see earlier in life and actually would be treatable in kids even. But people in their 20s and 30s should be empowered to know what their risk is, get their cholesterol tested, and work to reduce their risk, focusing on lifestyle pieces, diet, exercise, sleep, stress management, having healthy weight, having healthy blood pressure, and then knowing what their unique cholesterol goal should be.
You're saying that this is silent, so then what are the symptoms that one would say, hey, you know, I need to get this checked out, or you just have to get tested in order to know?
That's a big part of these guidelines, is to say there aren't going to be symptoms to high cholesterol. So you should be tested as a child, you should be tested at age 18, and then start to think about, hey, I might need to know my risk have a more thorough risk assessment to see if I should be treated at age 30. And symptoms would come much later. So that's what we're trying to prevent, is we don't want to get to the point where people are having chest pain or shortness of breath. We want to be way upstream of that to say, let's address these risk factors to prevent development of disease ever in life.
How does one test their cholesterol?
Simple lab test.
It's a blood test.
Exactly.
Lab test. Okay. Well, this will hopefully be a reminder for people watching. If they haven't, do you have to do it every 6 months, every year? How often do you get that cholesterol tested?
Should be tested in adulthood, and then if we're treating, should be followed up to make sure we've achieved our goals.
Okay.
So age 18, if we're going to treat, then we are going to follow up with additional testing. Otherwise, following up every 3 to 5 years would be
3 to 5 years. All right. Dr. Elizabeth Epstein, we appreciate your time. Thank you.